Hi, I'm Dr. Paul Lederer, and today I'm going to discuss the kind of cases that seem to make my day on a daily basis. When I see patients that sometimes don't understand that they have a visual problem, it can be the most fascinating of evaluations. First of all, it was on Saturday, about a week ago, that I see an 8-year-old young man come to my office, referred by friends of the family. This young man was accompanied by his father. And the child, when interviewed at first in his history, indicated he had no visual problems. Things were easy for him, he had normal sight, and everything looked good. Now when asked the father about any previous visual examinations, he said that he had gone through 2 recent visual exams that both showed that he had normal sight, normal health, and that he did not require any need for glasses. Now, interestingly enough, family members knew of the work I did and said, why don't you take him to us or to me? And I had the chance and opportunity to evaluate him that Saturday morning. Now, what was interesting is in the very beginning of my evaluation, I noticed something that was quite unusual and unexpected, a one eye higher than the other kind of measure, and what we call an alternate cover testing and a unilateral testing, which meant that one eye was positioning higher than the other. Now, when asking about this, he was unaware until I showed him what was going on. And as I did, it started to reveal itself that this could be the cause of a lot of the difficulty he had with reading and sustaining concentrated attention and focus, which was being misdiagnosed and thought to be misdiagnosed as a visual attention deficit, despite the fact that he loved being read to over long periods, that he didn't seem to have good focus and his hand-eye coordination was being affected, and his sports were not what they should be, especially when it came to smaller ball sports. Now, this one eye higher than the other did not just reveal itself in the straight ahead position. In fact, it became far more dramatic and yet totally unaware to this child that when looking to the far left or right extremes, he was seeing double vision. And this motor muscle limitation to eye movement had been there since he was a baby. Now, what I think was uncanny was that as I was explaining the fact that this condition existed, and explained that often a child will tilt their head in order to align their eyes to gain some sort of eye teaming or binocular vision, that this condition was causing coordination problems within his eyes and was really compromising his performance and his attention in school, sports, and other activities. Interestingly enough, the father looks at me and says, "You know, now that you explain that, I also have that problem." That's why I've been tilting my head all these years. In fact, I've looked to the right and I almost see double 2 at times to the right and to the left also. So as it turned out, the father had had this problem his entire life and was never aware why things were difficult for him. And so too did his child. And that his child became a gift to him of understanding this condition and the way it affected his performance and their lives. So too is this type of everyday experience, even on just the initial examination, a representation of what I do and why I do it. And it's this condition that can be explained and understood, and this condition that can be treated and improved upon, that seems to me to be the most motivating thing within my practice. An initial exam that unfolds before my very eyes to help people live their lives better, fuller, with greater potential and less visual stress, and understand the nature of how visual problems contaminate their perspective on who they are and who they think they could be.